What I want to show you on this slide is that that this benefit, even of low volume exercise, just 15 minutes of continuous exercise a day. We got everything to the left. That's benefit. So it doesn't matter if you're a man, you're a woman. Doesn't matter if you're young or old. It doesn't matter if you have hypertension, don't have hypertension, diabetes, no diabetes. It doesn't matter. It benefits everybody. We'll just kind of go quickly over this. There's a lot of data here, but again, specifically because we're a lung cancer group here, I highlighted lung cancer. We were talking about for all cancer types, but even lung cancer types benefit there. So if you look across for the inactive people, again, they get that hazard ratio score of 1 that's neutral. Anything less than 1 is beneficial on this table. And if you look across there for medium, high, very high levels of physical activity among the lung cancer patients, all those HRs, those hazard ratios are all less than 1. So it benefits lung cancer population. And finally, I don't want to neglect mentioning the importance of managing hypertension, both in the general population and in patients with cancer. And as you can see by the downward slope of these lines representing mortality due to ischemic heart disease versus systolic blood pressure on the left side and stroke versus systolic blood pressure on the right side, the risk of heart disease and stroke diminishes in all age groups as blood pressure improves. You don't need large changes in blood pressure to produce a beneficial effect. So a 10 millimeter mercury reduction in systolic blood pressure reduces the risk of stroke death by 40%, reduces the risk of ischemic heart disease, heart attack death by 30%. And even just 2 millimeters reduces the stroke death rate 10% and the ischemic heart disease death rate 7%. So it's kind of like exercise, even a little improvement produces really big effects. So you can say you get a lot of bang for the buck with doing those two things. So hypertension is potentially one of the multiple hits that contributes to increased cardiovascular mortality in cancer survivors. And when present, it actually has a huge effect. But the good news is that hypertension is also highly manageable. And these are 4 things that people can do to lower their blood pressure. If you're overweight, try to lose about 5% of your body weight. That's about 10 pounds for most people. Lower your daily sodium intake by 1,000 milligrams or to a total of less than 1,500 milligrams a day. You're going to have to read food package labels for sodium content. Avoid prepared foods. Try to cook from scratch and add less salt than what recipes may call for. Get 150 minutes of moderate intensity exercise per week. Again, get a little perspiration on the brow doing that exercise. And reduce your alcohol consumption to not more than 2 drinks per day if you're a man and not more than 1 drink per day if you're a woman. And doing all those things could potentially improve systolic blood pressure by 20 millimeters of mercury without additional medications. Strive to maintain resting blood pressure generally under 130/80. So if you don't have hypertension and you don't have heart failure, then you could use salt freely. On the other hand, if you have hypertension, then you do have to cut back on the salt. Clearly, for management of hypertension, if you have hypertension, cutting out the salt or reducing it is best. This is the end of my talk. We covered a lot of ground, looked at a lot of tables. What I want you to do is to take these 4 things home with you. So make regular exercise part of your daily routine. That's going to help. Review your chest CT scan report for mention of coronary calcifications so that nothing is missed. And if you're at risk, that risk is addressed. Don't smoke. And finally, manage your blood pressure. So this is a quote, Francis Bacon. He said, knowledge is power. And it really is, because you can take charge of things. You do have some control. A lot of times you feel like you don't have control, but you do have some control.